everyone. My name is Elise Lewis, and I am Miss Blackboard of 2020. I had intended originally to create a series of videos talking about health and wellness, but in light of the recent coronavirus outbreak, I am doing a series that's going to try to keep people aware of some of what's happening in my home state of Florida. I'm still going to offer the health and wellness videos, but this is a very pressing issue, and I want to make sure that people are aware of exactly what is going on from the executive order standpoint. So I, just for myself personally, have been going to the DeSantis website. Our governor is Ron DeSantis, and he has a website. It's www.floridagov.com, which you can see I have up on the screen right here for everyone to see. If you go to his website, scroll all the way to the top, and select Info Center and click Executive Orders. It'll give you the 2019 and 2020, the most recent years for executive orders from our governor, for 2020 for the current year. And you can scroll through and see all the different orders that we've been given. Most recently, of course, most of the orders are related to the ongoing COVID epidemic. The first came out on the 1st of March, and I'm just going to read that for you. And for each video, I will read a different executive order so that you can go through and see what's changed through time. And then in my own words, I'll kind of try to give a little synopsis of what I think that this means for our state or for others. So from the 1st of March, State of Florida, Office of the Governor, Executive Order Number 20-51, establishes COVID-19 response protocol and directs public health emergency. Whereas coronavirus disease 2019, or COVID-19, is a severe acute respiratory illness that can spread among communities through respiratory transmission and presents with symptoms similar to those of influenza, and whereas in late 2019, a new and significant outbreak of COVID-19 emerged in China, and whereas the World Health Organization declared COVID-19 a public health emergency of international concern, and whereas in response to the recent COVID-19 outbreak in China, Iran, Italy, and South Korea, the Centers for Disease Control and Prevention, or CDC, has deemed it necessary to prohibit or restrict non-essential travel to or from those countries. And whereas in response to the recent COVID-19 outbreak in Japan, the CDC has advised older travelers and those with chronic medical conditions to avoid non-essential travel and all travelers to exercise enhanced precautions, and whereas the CDC currently recommends community preparedness and everyday prevention measures be taken by all individuals and families in the United States, including voluntary home isolation when individuals are sick with respiratory symptoms, covering coughs and sneezes with a tissue and disposal of the tissue immediately thereafter, washing hands often with soap and water for at least 20 seconds, use of alcohol-based hand sanitizers with 60% to 95% alcohol, if soap and water are not readily available, and routinely cleaning frequently touched surfaces and objects to increase community resilience and readiness for responding to an outbreak. And whereas 2 individuals in the state of Florida tested presumptively positive for COVID-19, including a resident of Manatee County and a resident of Hillsborough County, and whereas the CDC currently recommends mitigation measures in communities with COVID-19 cases, including staying at home when sick, keeping away from others who are sick, and staying at home when a household member is sick with respiratory disease symptoms, or if instructed to do so by public health officials or a healthcare provider. And whereas it is necessary and appropriate to take action to ensure that COVID-19 remains controlled and that residents and visitors in Florida remain safe and secure. Now, therefore I, Ron DeSantis, as Governor of Florida, by virtue of the authority vested in me by Article 4, Section 1A of the Florida Constitution and all other applicable laws, promulgate the following executive order to take effect immediately. Section 1. Because of the foregoing conditions, I direct the State Health Officer and Surgeon General, Dr. Scott Whipkeys, to declare a public health emergency in the state of Florida, pursuant to his authority in Section 381.00315 Florida statutes. The State Health Officer is authorized and directed to use his judgment as to the duration of his public health emergency, Section 2. In accordance with Section 381.0011(7), Florida statutes, I direct the state health officer to take any action necessary to protect public health. Section 3. I direct the state health officer to follow the guidelines established by the CDC in establishing protocols to control the spread of COVID-19 and educate the public on prevention. Section 4. In accordance with Section 381.00117, Florida statutes, I designate the Florida Department of Health as a lead state agency to coordinate emergency response activities among the various state agencies and local governments. The state health officer or his designee shall advise the executive office of the governor on the implementation of these emergency response activities. Section 5. All actions taken by the state health officer with respect to this emergency before the issuance of this executive order are ratified. Section 6. The Florida Department of Health will actively monitor, at a minimum, all persons meeting the definition of a person under investigation, or PUI, as defined by the CDC for COVID-19, for a period of at least 14 days or until the PUI tests negative for COVID-19. Active monitoring by the Florida Department of Health will include at least the following: risk assessment within 24 hours of learning an individual meets the criteria for a PUI. Twice daily temperature checks. It's A and B. Section 7. The Florida Department of Health, pursuant to its authority in Section 381.00215 Florida statutes, will ensure that all individuals meeting the CDC's definition of a PUI are isolated or quarantined for a period of 14 days or until the person tests negative for COVID-19. Section 8. I hereby direct the Florida Department of Health to make its own determinations as to quarantine, isolation, and other necessary public health interventions as permitted under Florida law. In Section 9. I direct all agencies under the direction of the governor to fully cooperate with Florida Department of Health and any representative thereof in furtherance of this order. Agencies not under the direction of the governor are requested to provide such assistance as is required. In testimony whereof I hereunto set my hand and cause the great seal of the state of Florida to be affixed at Tallahassee this first day of March 2020, Ron DeSantis, Governor, attested by Secretary of State, and it's stamped there. It looks like 9:31 p.m. So this is the very first executive order, to my knowledge, that we as the state of Florida specifically received in regards to what's ongoing with COVID-19. It's important to keep track of what's going on here. I showed you the website at the beginning of the video. Again, you can go to flgov.com, click Info Center, and select the current year 2020 to scroll through all the executive orders we've had. At the beginning of this process, we only had a few, and they've been ramping up, and it's very important to be aware of what exactly they say, because it gives us guidance. It tells us what the new rules are in this state while this is going on, and it provides some important information as to who is in charge of what we're trying to maintain here in terms of health, in terms of the public policy, what's legal, what's not. As you can see in the most recent order, a lot of what they're trying to make people aware of was the fact that we are in a public health emergency. This is not the flu. It's not what we're used to getting every season. It's something that is dangerous. It is easy to transmit from person to person. And there were already two people, one of them not far away from where I live in Hillsborough County, in this state. Today, I'm very sad to say that we have over 6,000 cases in the state of Florida. This was on March 1st. There were 2 cases. It is currently March 31st, and we have over 6,000. So stay informed, be safe. If you can stay indoors and avoid close contact so that this doesn't spread any further, absolutely do so. Wash your hands. Use the hand sanitizer with a 60 to 95% alcohol if they're recommended that you use. And stay tuned to what the CDC or the World Health Organization and your local state officials are advising that you do. This is Miss Black Florida signing off.